Now let's turn to a live look at Capitol Hill, where federal lawmakers are working to pass President Trump's budget. Tonight we're learning that looming federal cuts to Medicaid, housing, and flood aid are now threatening San Diego County's new $8.6 billion budget. The Board of Supervisors approved the budget today, but federal cuts could cost the county hundreds of millions of dollars and impact more than 1 million residents.
CBS 8's Richard Allen breaks down the budget and the county's plan to prepare for the fallout. Richard?
Well, that's right. A lot of people are paying very close attention to this. Now, leading up to the Board of Supervisors passing the new budget, which takes effect 1 week from today, they also greenlighted a proposal to begin planning for these anticipated federal cuts, which would then shift the burden onto the county. As Board Chair Tara Lawson-Remer said today, quote, "Our county budget is balanced for the moment, but it doesn't yet reflect the scale of what is coming."
And these possible threats are very real.
San Diego County resident Julie Porter, who had previously spent several years living unsheltered, is intensely aware of the looming federal budget cuts.
It's always on my mind. It's always on my mind.
Cuts which could potentially strip away her health care coverage as a Medicare recipient, as well as the housing assistance the 67-year-old now receives, providing her a roof over her head.
They'd have to take me kicking and screaming. It would kill me to go back to the street.
And I'd rather have a plan before we have the crisis. The crisis is now, and I'd like to get the plan in place so that we're able to rise to the moment.
Board Chair Tara Lawson-Remer, along with Supervisor Monica Montgomery Stepp, put forth this proposal to begin preparing now for federal budget cuts that could likely be imminent.
Is about having a plan for San Diego County. That's really what this is about.
These projected federal cuts, which the county would then have to take on, include $276 million to CalFresh food benefits, $10 million for behavioral health services, $20 million in housing programs, and new Medicaid requirements that could disrupt coverage for nearly 900,000 residents. Over the coming weeks and months, county workers will now assess the potential impacts and come up with possible options to address these shortfalls.
We need to prepare. I think that we are a county of 20,000 employees, an $8.6 billion budget.
A budget that also passed Tuesday, which includes $132 million to help house vulnerable populations, a $26 million increase for substance use outpatient services, more than $48 million for road safety, and $843 million to assist more than 1 million San Diegans to access public assistance programs like CalFresh and Medi-Cal.
And as for this new readiness plan for looming federal budget cuts, county officials will now come up with ways to avoid coverage delays or benefit losses by July 22nd, and also come up with a fiscal analysis of the situation, including funding options for services by September 30th. A lot to do.
So, Richard, if these federal cuts are approved, when would people here in San Diego County actually feel the impact?
Well, Tara Lawson-Remer earlier today said that they would be phased in. So probably the earliest we would feel them is January of next year. But that said, there's a lot of preparation that has to take place before that happens. And that's why it's important to start developing a contingency plan now. I mean, January will be here before you know it.
And again, for our viewers who haven't been keeping close tabs on this, where are we with the federal budget process?
That's right. So the House of Representatives, they've passed it already. The Senate is now debating it. President Trump has said he would like a budget passed before or by July 4th. Today, he went on Truth Social and basically said no one's going on vacation until a deal is reached.
All right, we'll have to wait and see.
But he can't tell them that, right?
Right.
That's the whole thing. Congress gets to decide when they take it.
There we go.
Thanks, Richard.
Thank you.